Hello, my name's Adrian Richards. I'm a consultant plastic surgeon and also the surgical director of Aurora Clinics. In this short video, I'm just going to be taking you through the different classification of breast ptosis, and ptosis is the medical word for droop, so it's breast droop. And I'm going to be taking you through the normal situation, grade 1, grade 2, grade 3, explaining a little bit about pseudoptosis and parenchymal malposition. So the first situation is normal, and essentially in the normal situation the nipple here lies above the fold beneath the breast. So the fold beneath the breast is known as the inframammary fold. If the nipple lies above that, the situation is classified as normal with no significant breast droop or ptosis. People can get decreased volume in this area, particularly after weight loss and pregnancy and childbirth, so you can get more scooped in and concave in that area, but the important thing is to assess the position of the nipple compared to the fold, and you can do this by looking at your chest from the front and measuring where the fold is, perhaps putting a ruler in the fold, and then assessing is your nipple above the fold. The important thing in this situation, the normal situation, is that you won't need a breast uplift, you will just need a breast enlargement that can be behind or in front of the muscle with different shaped implants, which I'm going to talk about in other videos. But essentially you don't need a breast uplift if your nipple lies above the fold. Now moving on to grade 1, this is where the nipple lies at the fold. So looking again from the front, you'll notice with the ruler underneath the fold that your nipple lies at the same height. This again occurs after pregnancy and weight loss. And is best treated certainly with an augmentation in most cases to give more volume to this upper part here, but in some cases also a breast uplift. So if you're looking for a natural appearance, perhaps you don't need a breast uplift with a grade 1, but if you are looking for a higher nipple position and you don't mind the scarring, but a breast uplift to lift that nipple to that position there, in the same position as in grade 1, might be an option for you. And I would suggest probably looking at our operation videos and information videos on Mastopexy for more information about Mastopexy. So probably an augmentation combined with a short scar Mastopexy would be appropriate in that case. Moving on to grade 2, this is when the nipple lies below the fold. So the problem with just a breast implant in this case is the breast implant is naturally going to go down to the lowest part of the breast and can give you a rather unnatural low appearance to the breast. So if you are grade 2, if your nipple lies below the fold when you look at yourself from the front, really a uplift combined with implant is probably the ideal if you want more volume here, which the implant will give you. If you just like a slightly better shape, don't mind the scars, and don't want to go any bigger, an uplift would be appropriate. Grade 3 really is just more of the same. We get more descent. This typically occurs with people who've got really very big during pregnancy or have lost a lot of weight, and the nipple really comes down to the lowest part of the breast. Again, in this case, nearly always I would recommend an augmentation to restore the volume in this area here, because in grade 3 really all the volume is in the lower part of the breast. So what we need to do is restore the volume here and elevate the nipple. You can do this with a Mastopexy procedure on its own. It's going to give you a very natural result, but if you want the extra volume in this area, I think the best option is really an implant, and that can often be placed behind the muscle which lies here, because you haven't got much tissue here to cover the implant. Pseudoptosis is an interesting condition where actually the nipple does lie at the level of the fold, you can see here, but because there's quite a lot of tissue on the lower part of the breast here, the breast looks droopy, although in fact the nipple is in the normal position. This normally occurs after surgery, either when too big an implant is placed normally in front of the muscle and then it will sink down into this position, or alternatively when you have a breast reduction and using an inferior pedicle technique, and in an inferior pedicle technique the bridge of tissue that supplies the blood supply to the nipple is in this area here and can sort of sink down to this lower part, filling it out. So pseudoptosis is a condition where the breast looks droopy, but in fact the nipple is in a normal position, and it's normally treated by reducing this area of tissue here, so removing a segment, say from here to there, and sewing that area to there, restoring the normal contours of the breast. The last one I'm going to talk about is parenchymal malposition, which is essentially a medical term for a short fold beneath the breast. So parenchymal just means breast tissue, and malposition just means in the wrong place. Essentially, if you measure this distance here, the nipple to the fold distance, in most cases with parenchymal malposition, this can be 3, 4, 5, 6 centimeters, and in most normal people it will be at least 7 centimeters. So it's really just characterized by a short fold to the lower breast, and is normally corrected by a breast implant inserted slightly lower here, and then that will lower the fold and give a much more natural full appearance to the breast. So just to run through things again: normal, you're only going to need a breast implant, no uplift required there. Grade 1, if you would like a natural look, a breast implant either in front of the muscle or behind the muscle is probably the best option for you, but you can have a breast uplift. Grade 2 and 3, if you would like to be the same size and would like a natural look and don't mind the scarring too much, probably Mastopexy is the best option for you. But if you would like to be a bit fuller in the upper portion, a bit bigger, a Mastopexy augmentation. That can be performed as a one-stage operation or as a two-stage operation, and I talk a lot about that in other videos. Pseudoptosis is called bottoming out of the breast, when the breast tissue is too prominent in this area, either produced by an implant going down or by surgery, where the majority of the tissue is in the lower part of the breast, and normally treated with removing this area of tissue to give a more natural appearance to the lower part of the breast. Parenchymal malposition is a congenital condition of the breast, a developmental condition that you will notice probably in your teens, characterized by very short nipple to inframammary fold distance, and is normally corrected with a breast implant to give more volume in the top part of the breast, and also to fill out the lower part of the breast more. So thank you very much for listening to and watching the video. I hope you found it useful and informative. Please have a look at some of our other videos on breast surgery. There's videos on types of implants and whether they're placed best behind the muscle, which you may like to see. So again, thank you very much. If you'd like more information, please visit our website, aurora-clinics.co.uk, or give us a ring on 01844 214 362. Thanks very much for listening.